straight in at number 1, we've got LA versus GA for gynecomastia. Question for the Q&A. I see that some surgeon, nice to have a bit of gynecomastia on there. Thank you for a gynecomastia question. I see that some surgeons seems to opt for local anesthetic rather than general for gynecomastia. They seem to advocate cheaper costs and better recovery. If it's that much better, why does everyone not choose that method? Any pros, cons in either method? Thanks in advance. What a good question. What a good question that is. Wish I'd thought of that. Right, get yourself comfy there. Wheel yourself in. Absolutely right. Now, anytime one person says one thing's better, then you've got to think, why doesn't everyone do it that way? So, LA for gynecomastia. Now, there's LA, as in local anesthetic. There's local anesthetic, which means an injection in the area to numb the area. That's sort of pure local anesthetic. And there's local anesthetic and sedation. Two different things, really. When you combine local anesthetic with sedation, it's a slightly different thing to just pure local anesthetic. So I would say that gynecomastia, pure LA, pure local anesthetic is pretty rare. So I have done revisions. I did one not that long ago, and I believe we videoed it. Should I put the link? I should put the link and all that sort of stuff, shouldn't I? Anyway, you interested? Anyway, I believe we videoed it. What happens when I change my web page? Do you guys still see me? So, and that was really just the revision. It's a patient who'd had gynecomastia correction already, and he had a little bit of breast tissue just behind the nipple, which I then went and removed for him under local anesthetic. Now, that was pure local anesthetic, and that was obvious. Well, that was free because he didn't. He had surgery by me before, and I don't charge for revisions, and that was a revision. But if it was a paid for procedure, it would have been a lot cheaper than a standard gynecomastia because that was under pure local anesthetic. So that's just me and the patient, and it would have been a lot cheaper. I think it was this one, was it? Not sure if it's this one, but I think this looks like it could be the one. So that would have been a lot cheaper if it's under pure. Back in the room. I don't know if I went then. Did I go? Did I go and come back? Oh, what is gynecomastia? Oh God, right. I'm not making. Sorry, I'm not. Can I do this? Can I do this? Oh, here we go. Here is the video. Actually, you may not want to watch this video because it's like of gynecomastia and LA. Is that going in the chat? I think that's the video anyway. Gynecomastia, good question. What is gynecomastia? So gynecomastia is excess breast tissue in a male. So it's a male breast reduction. Gynecomastia correction is a male breast reduction. Man boobs, moobs, whatever you want to call it, excess breast tissue in a male is called gynecomastia. So men who don't like the having excess breast tissue, then they have gynecomastia correction. So as I say, if it's just a tiny little bit of breast tissue behind the nipple, you can do that under pure local anesthetic. In my experience, it's never that. That's only the one that I've posted there is just a patient who had a little bit residual gynecomastia tissue after having full-on gynecomastia correction. So in my experience, gynecomastia correction needs a more extensive operation that can be done under pure LA. So for me, gynecomastia correction is going to be either LA and sedation, which is also known as twilight anesthetic, if you've heard of that, or GA. And there are definitely pros and cons of it, but one of the pros and cons of LA and sedation versus GA is not is not cost. It is not cheaper to have it done under LA and sedation than GA, and this occurs for other breast surgery which needs LA and sedation. So cost is not a factor because it's the same price if you have LA and sedation / twilight anesthetic, same thing, versus GA. The reason being that you still need an anesthetist. If you do pure LA, if you're just injecting local anesthetic, you don't need an anesthetist. I do the local anesthetic, and it's just, as I say, it's just me. You don't need an anesthetist. You don't need an operating theatre. Or at least you don't need an anesthetic machine with a ventilator. You just have like we have a minor operating theatre at the clinic, so we can do local anesthetic cases there. But we don't need a full-blown operating theatre where general anesthetic cases are done. So LA and sedation is different to pure LA, and so I would say to you that so cost isn't an issue in terms of LA and sedation versus GA. The main issue in terms of LA and sedation versus GA is patient selection. And when I talk to someone about surgery like gynecomastia, like breast augmentation, I usually talk about GA, to be honest with you, because it's a little bit uncomfortable. It's quite invasive. You're operating on quite a large area, whether it be a male or a female breast. Although men say that the gynecomastia is just a little problem behind the nipple, it's usually part of more of extensive area that you need to feather in. If you just take the breast tissue from behind the nipple and you don't do anything else to the rest of the breast tissue in the man, then you can end up with a dent and contour deformities. So usually what gynecomastia correction involves is cutting out that dense breast tissue, that glandular tissue behind the nipple, which is a localized thing, and then liposuction to the rest of the breast to feather it in, to contour it, so you don't just get a sudden dent. And the liposuction is a little bit uncomfortable. It's a little bit uncomfortable. There's a bit of pushing and pulling, and is something that can be done under local and sedation, but the patient has to be up for it. The patient has to be on board with it because it is a little bit uncomfortable. And to be honest with you, often it's just as easy to do it under a GA, but there is less of a recovery. You do feel less of a hangover effect with a LA and sedation. We tend to do it in theatre, in main theatre, so we can always convert to a GA if required. So you can have it done under LA and sedation, but the default position, if you like, is a GA, and mainly because it's a bit uncomfortable. So the pros and cons are it can be a bit uncomfortable if under LA and sedation, but the recovery is quicker. Having said that, the recovery after a GA for a gynecomastia usually isn't too bad, but as I say, it is a bit worse than if you had a LA and sedation. And cost is not a factor. If you are talking to someone who is talking about pure LA, one of the sayings we've got in plastic surgery, or maybe it's just in the world, is if all you've got is a hammer, everything looks like a nut. Why was I thinking about nuts? Everything looks like a nut. Can you hear what's going on behind me? I think the dog has just eaten the dinner off the dinner table. Sorry. If all you've got is a hammer, everything looks like a nail. Not a nut, a nail. We'll just copy that bit out when we do it live, yeah? Cut the nut bit out, yeah? So you could be a bit careful. If someone's just doing under LA, it might be that they can only do it under LA. They haven't got any GA facilities. They haven't got practicing privileges in a hospital where they can do GA. That's what would worry me if someone's doing gynecomastia under pure local anesthetic. Having said that, if they are doing it and they've got good results and they've got happy patients, then who am I to say? It might be that it's okay to have it done like that way. So yeah, I think we've covered that.